We asked our teachers some simple questions about cholera. This was their replies. Mr. O'Hara.
Have you ever heard of cholera before?
Yes, I have heard of cholera before.
If you wanted to know a bit more about cholera, what would you want to know and why?
I would like to know what caused it in the first place. I know the effect that it seemed to have had, but I don't know what caused cholera to happen or the big outbreak to happen.
Do you know if you were to go to Dundee where you could look if there was something you wanted to know about cholera?
No, I couldn't tell you anybody would go to find out about cholera.
Thank you. Miss Ramsey, who used Google. Heard of cholera before?
Yes, I have heard of cholera before.
Could you please tell us a bit about what you know about cholera?
Well, I did think it was a childhood disease, but then I realised I got that mixed up with something else. Is it not a disease that, I think it is more in African countries and countries of poor hygiene, and it's a watery disease in the water and poor sanitation, and it gives people upset tummies, and in the poorer countries they can die from it.
If you were to want to learn a bit more about cholera, what would you like to learn?
Maybe how it can be avoided, and if there's anything we can do. If it is something that's a disease in other countries, maybe if there's anything we can do in this country to try and help and stop it spreading.
Thank you.
1832 cholera epidemic of Dundee. Dundee is a very historic city and is home to many a historic hospital.
The Dundee Cholera Hospital, whose story is all but unknown.
Last recorded case of Scottish cholera was on the 23rd December 1831. The virus had travelled from China or Russia. It took roughly 12 hours and 5 days for the symptoms of cholera to be known. Cholera would cause 10 to 20 litres of diarrhoea, equaling this amount of iron brew. Cholera would thrive in unsanitary conditions such as here. 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 In the 1800s, it wasn't just your family sharing a loo, but your neighbours, their families. Sometimes even a whole street would be confined to one loo. As you can imagine, the poor sanitation of the Overgate area led to a swift outbreak, especially considering cholera is contracted by consuming an infected person's feces.
Unfortunately, the survival rate of cholera was low. It stood to 50 to 60%.
Due to the highly contagious nature of the illness.
In the 1830s, the most popular method of cholera treatment was advising sanitary habits such as washing, drinking safely, keeping streets clean, and dressing warmly.
Bloopers! As you can imagine, the poor sanitation of a very historic city and
Juicy!
Unfortunately, the survival rate of cholera was low. It stood to 50 to 60%.
anyone got measuring tape?